And what color is this?
Gray.
Perfect. Okay.
Right.
Thanks for coming in. Before we start the examination, can you go ahead and verify your first and last name?
Yes, first name is Ivy, last name ASMR.
Okay, and your date of birth, please.
Date of birth is June 22nd, 1992.
Okay. Do you suffer from any allergies?
No, she's not.
Allergies. And are you taking any medications on a daily basis?
No. I take ibuprofen sometimes for migraines.
Okay. And any history of hypertension?
No.
Okay. Any history of thyroid problems?
No, I do have family history of it, but I don't have any myself.
Okay. Is it maternal or paternal?
Maternal.
Okay. All right, go ahead and tell me what's bothering you today.
I've been having a little bit of like pain on my right ear. It feels like sometimes when I chew, I can even hear it like popping or some cracking in the ear, and it just hurts a little bit around it. I haven't really noticed any hearing loss, but yeah, it's mostly the pain.
Okay. Right ear popping. On a scale of 0 to 10, how bad is the pain?
I would say maybe a 3 or 4, but it's just annoying.
Is it
it's pretty
constant?
constant? Yeah.
And how would you describe it? Is it sharp? Is it dull?
It's dull. It's just pain, mostly like on this area. Sometimes also kind of like down here.
So it radiates in front of the ear too?
Yeah, sometimes.
Any popping sounds on the left side?
No, I have not noticed that. It's mostly the right.
Okay. Any grinding of your teeth? Do you think you're doing that at night or during the day?
Not that I know of. And I haven't never been told that I grind my teeth at night, so.
Okay. Do you snore?
No.
Okay. Any dental work in the last 5 to 6 years?
Nothing major, just like cleanings.
Okay. Do you have any missing teeth?
No. I think I did have my wisdom teeth removed, but that's it.
Okay. Sometimes a missing tooth could cause some imbalances and cause that bruxism. What we're talking about is the grinding in your teeth. Okay, and do you feel that you're tensing your muscles, your jaw muscles a lot?
I do think I do that a lot when I'm stressed, and it's a lot lately.
Okay. Do you think you may be putting a little bit more pressure on the right side compared with left?
Not that I can tell.
Okay. And have you had any scans done recently? Any CT scans or MRIs?
No.
All right, so we're going to schedule you for an MRI of your right and left ears. And we're also going to look at the muscles and the joint make sure that there is everything aligned. And if we find that you might be having some problems there, then we're going to recommend your specialist.
Okay.
All right. We're going to take some vital signs first. I'm going to put this on your index finger. We'll take your vital signs and temperature. And this will go on your upper right arm. Okay, I'm going to ask you to uncross your legs. Okay, blood pressure is normal, 110/60. And let's go ahead and check these numbers. Oxygenation is 98%, heart rate 82. Okay, and you have no temperature. Is it okay if I listen to your heart and your lungs?
Okay.
I'm just going to move the stethoscope this way. Okay. I can hear only S1 and S2, no S3, no S4. Let's go ahead and see if we hear any murmurs. Can you take a deep breath in and hold it for 1, 2, 3? Very good. Okay, go ahead and take a deep breath in and exhale. And one more breath in and exhale. Take a deep breath in and breathe out. And on the other side, take a deep breath in and exhale. Okay. Breath sounds are also normal. Okay. We're gonna go ahead and do a cranial nerve examination, so we're going to test all 12 cranial nerves. That includes vision as well. Do you wear contacts right now?
Yes.
Okay. I'm gonna have you look straight in my nose without moving your head. Go ahead and look straight. We're just looking for pupil dilation. Good. And now I'm gonna have you follow the light with your eyes only. Don't move your head, okay?
Okay.
Okay, and now I'm going to bring the pen light closer to your nose. Go ahead and look at the light. Okay. I'm going to have you cover one eye. And can you please tell me what color and what object do you see right here?
A cat.
All right. What about here?
A duck.
And what color is that?
Yellow.
All right. What color is this?
Red.
Okay. And what color is this?
Gray.
Go ahead and switch eyes. Okay. What do you see here?
Blue. It's a mug.
Okay. And what letter do you see inside?
E.
Okay. And what color is the star?
Yellow.
Okay. Okay, to check your ocular nerve. For that, I'm going to have you look straight behind me at the wall. I'm going to come very close to your eye.
Okay.
Okay. All right, I'm going to have you look there. Okay. Very good. Everything looks normal. Let's go ahead and check your reflexes. I'm going to have you relax your jaw a little bit more. Good. Perfect. Okay. And I'm going to tap along these sides. Let me know if you feel any kind of tenderness.
Okay. A little bit there.
It's definitely a trigger point.
Yeah,
Any
a little
pain
bit
there?
there.
All right. Which side hurts more, left or right?
Right.
Okay. Do you sleep on the left or right side? Usually. Do you prefer one side more than the other?
I think I sleep more on the left, but I just turn around a lot at night, so.
I'm going to press behind your ear. Let me know where it hurts more, left or right.
Right. Right. Right. Yeah, definitely on the right side.
Okay. I'm going to ask you to open your mouth gently, a little bit more. Okay, go ahead and close. Any pain on the left or right when you're opening your mouth? Go ahead and do that again. And close.
A little bit on the right, yeah.
Okay, so we have encapsulitis on the right side. Any pain here?
No, barely.
Okay, any pain here in the back?
No.
Any pain radiating in front of your neck?
No.
Okay. Going to tap on your shoulders. Let me know if you feel any pain. I'm looking for neurological responses. Okay, normal neurological responses. Very good. Okay, I'm going to touch you with two objects. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to feel dull. This is what dull is going to feel like.
Okay.
Go ahead and tell me if you feel sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Not really sure I felt that. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. Sharp.
Okay, everything looks very good. What I'm gonna do now, is I will check your taste. I have here some samples. What I'm gonna do is I'll put the paper on your tongue. I'm gonna have you taste it and let me know what that tastes like. So this is sample one.
Tastes a little bit better.
Better. Okay. Surely I can tell if there's a problem with only two samples.
Better too.
Is the one more better than the other?
No, they taste pretty similar.
Okay. Okay, what about this one?
Doesn't taste like anything.
Okay, perfect. And have you noticed any changes with your smell?
I don't think so.
Okay. Alright, first we're going to verify that both ears are patent. I'm going to ask you to cover one nostril, breathe in, breathe out. Okay, no obstruction there. Good. And go ahead and tell me what this smells like.
Garlic, maybe?
Okay.
It smells like either smoke or cloves. Like pineapple, maybe?
Okay. Everything looks good. What I'm gonna do now is I'll ask you to lay down and I'll take a look at your ears and see what's going on there. Okay. It does seem that there's a lot of tightness on the right side, so I'm wondering if it's some fluid buildup or just a muscular skeletal problem. Okay, we have to take a look inside your ear first to make sure that the tympanic membrane looks healthy. Alright, I'm gonna have you turn your head towards the left side. A little bit of redness and not really able to visualize the tympanic membrane, which it could be just some buildup of earwax. Let's go ahead and take a look inside here as well. Okay, we have the same problem on both sides. I'm going to go ahead and clean the outside of your ear. So this is going to feel a little bit wet. Is it okay if we remove the earrings?
Yeah, that's fine.
Okay. I'll do the same thing on the other side. This is going to feel a little bit wet. Okay. Now I'm just going to try to remove the earwax that is blocking the view. You might even notice that you're able to hear a little bit better and not have any popping sounds. Okay, just one more piece here. Okay, very good. Okay, I'm gonna have you swallow. Okay, good. And go ahead and open your jaw. Okay, can you open it as wide as you can? Alright. Let's go ahead and take a measurement of that. Go ahead and close. Okay, go ahead and open as wide as you can. Alright. Okay, so let's go ahead and try that one more time. We're going to take a look, see if we can visualize tympanic membrane. It does seem to be a little bit of fluid buildup behind the membrane, but it's normal color. Okay, and you have the same problem on both sides. I'm going to perform some acupressure, and this is going to help to alleviate some of that fluid buildup. Most likely it's just lymphatic fluid that has been accumulated. And sometimes that can be caused by stress, muscle tension. And this acupressure really helps to lower cortisol levels. Okay, I'm creating a vibration sound. Go ahead and tell me when you don't feel it anymore.
No. No.
Okay, can you please tell me which position here is louder, 1 or 2? So this is 1.
Okay.
And this is 2.
2.
And this is 1.
Okay.
And this is 2.
2.
Okay. Go ahead and tell me with which ear you hear this sound.
Right. Left. Both. Right. Left. Right. Left. Both.
Okay. I'm going to apply some pressure on the trigger points that were very painful for you. So just very gentle releasing tension that helps to activate the nerve receptors. Alright, I'm going to have you stand up and we're going to go ahead and discuss the results. Okay, Ivy, it seems like you're having classic symptoms of TMJ, temporomandibular joint dysfunction. We're going to go ahead and schedule you with an orthopedic dentist. He's going to be able to take measurements exactly for your mouth, and we're going to fix you for a retainer. That's going to help to not put a lot of pressure on these joints right here, and it's going to decrease your pain level.
Okay, sounds good.
Do you have any questions for me right now?
No, I don't think so.
Okay, we're going to schedule you as soon as possible. I think this is an urgent appointment. We want to take your pain very serious.
Okay, thank you. I appreciate it.
Okay. I'll see you soon.
Thank you.